Hello, everyone, and welcome to the very first episode of the Scoop podcast, where we're going to talk about all things testing, regulatory, go-to-market for infant formula. My name is Keren Breiterman. I'm the Senior Business Development Director here at Eurofins North America, and I look after our infant formula vertical. So on today's episode, I'm really going to introduce you to myself, what this podcast series is going to be about, a little bit about my thoughts on the industry as it stands today in the US. And we'll also talk about some of the guests I'm going to have throughout this podcast series. So let's begin. So let's start at the beginning. You might be wondering, who am I and why am I recording a podcast series about infant formula? So here at Eurofins, I'm the Business Development Director for the infant formula vertical. And really, I got into this industry by accident. I started my career in New Zealand, which is a very dairy-heavy country, and that really was my first introduction into the infant formula supply chain. I was working for a third-party lab similar to Eurofins at the time, and I got an opportunity to relocate to Singapore. And I was employee number 8. We were very much in startup mode, and it was a fantastic experience. But we realized very quickly that we couldn't compete with the local food labs in Singapore. They were doing things very cheap, and to maintain the high quality and service that we were offering, we just couldn't compete with them. So we decided to pivot, and we thought, what market segment really values quality and service over everything else? And time again, we ended up at the infant formula manufacturers. So that was our plan, and we just went for it. We went after the multinational corporations in Southeast Asia, and we were just super successful. So that's really how I got immersed into the infant formula world. And it became a passion of mine. I just believe in what they do and the quality of product that they put out. So when I moved to the US and was hired by Eurofins, I realized that was the same type of service that we needed to offer, just quality above everything else, and a high level of service, and really a white glove service almost offering. And I really believe that out of our Center of Excellence in Madison, that is the service we're providing. So why am I doing a podcast series? So there's 2 reasons. One is, for sure, I want to showcase Eurofins' capabilities in this space. I really think as a partner to an infant formula manufacturer, our service is second to none and our offering is second to none in the United States. Above and beyond just the regular testing, we are involved in method development, we are involved in troubleshooting, and we have so much expertise and experience with this matrix that you really couldn't find a better partner in the industry to work with you to bring your product to market. So that's one of the reasons. And I think throughout this podcast series, you'll see that come through. But the second reason that I really wanted to do this podcast series was in light of the backlash that I saw last year towards this industry in light of the shortage. And it was personal. I became a mother last year for the first time, and my baby was born into this shortage. So I felt a lot of the mother's pains, walking down empty supermarket shelf aisles, not being able to find your formula of choice or just any formula, right? So I think some of the outrage was justified. But I think, if you look at it 12 months ago, where we were in the United States, there were only 4 manufacturing companies that were approved to make infant formula for the entire infant formula population of the United States. That's crazy if you think about it, right? Good news is, by the end of 2022, we had 2 more sites that were approved by the FDA in the United States to make infant formula. And in addition, the Defense Production Act, or the DPA, that was issued in May, allowed for the influx of overseas infant formula to come into the United States and bypass a lot of the red tape that the FDA has set up for infant formula manufacturers to come to market. So let's talk about that red tape that I mentioned and why it's necessary. So infant formula is a sole source nutrition product, meaning that it needs to be able to provide to your infant a nutritionally complete meal each time. So if you think about your dinner plate, right, you'll have a certain amount dedicated to carbohydrates, to protein, to fat, and to vegetables, which would be your vitamins and minerals or your micronutrients. Each scoop of infant formula that you take out of the can has to represent that entire dinner plate. And the scoop after it has to be nutritionally equivalent to the scoop before it. So that's a pretty tall ask, right? So really, there's no room for error. That infant formula for the first 6 months of life has to be able to allow your child to grow and thrive And you can't have one scoop being heavy on carbohydrate, one scoop being heavy on fat, the next scoop being heavy on protein. They all have to be nutritionally equivalent. So it's a pretty tall ask for infant formula manufacturers when they come up with their product. So how does the manufacturer ensure that each scoop is nutritionally equivalent to the following one? And that is delivering a nutritionally complete meal to your infant. So they start off by spending a lot of time perfecting the recipe. The formula has to include the 30 nutrients that are mandated by the FDA. And the specifications or the guidelines that the FDA puts out in their CFR is very tight. So really every infant formula in the United States, in the market here, is nutritionally equivalent to each other. There's not a lot of wiggle room in between them. So typically the difference between the formulas is the way that the nutrient is delivered. So for example, one infant formula might deliver fat in the form of a whole milk powder, whereas other formula brands might deliver fat using a skim milk powder, but bringing in oil blends. So that's really kind of the main difference in between formulas. But really, every formula on the market is not very different from each other. So other differences that formulas will have, there'll be bioadditives that are not part of the mandated nutrients, but that provide other benefits to the infant. So these might be in the form of prebiotics, nucleotides, specific fats that the manufacturer might be wanting to add, such as DHA or lutein, taurine, and the list goes on and on. And really, at the end of the day, the infant formula manufacturer is just trying to mimic human milk as close as possible. So whichever way they can do that, that's really their go-to-market selling point. So it takes a while to perfect a recipe. And then, of course, any ingredient added to an infant formula needs to have GRAS status or generally recognized as safe. And that process can take months, if not years, to get approval through the FDA. So even if you think of something like whole milk powder, which seems like such a generic and basic commodity item, it's only recently been given GRAS status in infant formula. And that took, many, many months and if not years of submission process and approval processes at the FDA to get approval. So it can be quite a long process for an infant formula manufacturer just to get to the recipe stage and getting that approved. So where does Eurofins fit in with that? So we have a great division called the National Food Lab. And they will be featuring on one of my first episodes where they work with the manufacturer to really come up either with a recipe, come up with a process piece, idea generation, concept development, really all the way up to scale up for manufacturing. And they do a phenomenal job working with clients. And Cosmin Bellachou is actually going to be my guest from the National Food Lab, and he'll go into detail about their process and how they work with clients. And I think it'll be really interesting to show how Eurofins partners with manufacturers for that piece. Another episode that we have on the podcast will feature Tammy Olsen, our stability director, who will go into really the whole process that Eurofins partners up with a manufacturer to establish a shelf life of their infant formula to show that the nutrients at day 0 are the same as the nutrients at day 24 months, or not necessarily the same, but within the FDA specification limits. So that's a really great episode to look out for coming up. Now, infant formula is not a pharmaceutical product, but it's about as close as a food item gets to being pharmaceutical grade. After all, it's the only food your infant is going to consume for the first 6 months of life. So how does the FDA ensure that the product that's being fed to your child is going to ensure that your child is growing and thriving, right? You don't want to be feeding your child a subpar product for 6 months, and those are critical 6 months during a child's life. So actually, infant formula does go through a human clinical trial, just like a drug would. And prior to that, just like any other drug, it would go through an animal trial. And so that's known in the infant formula world as a PER study, or a protein efficiency ratio study. And our partners at the Product Safety Labs will be featuring on one of my episodes, and they'll go into all the details around what a manufacturer needs to do for PER, what a PER is, why we need to do it. And I think that'll be a really interesting episode to showcase, just the amount of rigor that the FDA mandates an infant formula goes into. So after all of this, formulation, shelf life determination, clinical trials, you've been able to show that your product meets the FDA guidelines for nutrients. You've been able to show that you've got a established shelf life. You've been able to show that an infant can grow and thrive on your formula. Now what? Well, now you need to show that your product is both free from microbial contamination and that it's meeting those nutrients that you're claiming on your label claim at each lot, at each production run that you're doing. And how is that established? Well, through laboratory testing. And so we've got 2 episodes dedicated to that in this podcast series. One for microbiology contamination, where we'll have Justin Heller featured, and he'll talk about our dedicated infant formula microbiology lab. And the last episode in this podcast series is dedicated to our Center of Excellence for Infant Formula Testing here in Madison. And joining me will be the president of the site, as well as 2 of the general managers. And they're going to talk about really how we overcome some challenges that we see with infant formula testing, and talk about our experience and really our depth of expertise when it comes to testing, not only for those mandatory label claim items, but also a lot of the new bioadditives that are coming up. So whether it's the protein profiles that we're trying to mimic human milk protein profiles, so it can be lactoferrin, alpha-lactalbumin, or some of the associations that we work with, so AOAC, and how we get methods published and validated. So I think it'll be a really interesting episode, just showcasing our breadth of expertise. So that was a lot of information. But in summary, I hope that this podcast series will highlight the amount of time and science that goes into making an infant formula, and why it shouldn't be an overnight process, right? We love our infant formula clients at Eurofins. We love their dedication, their innovation, and their commitment to providing a safe and healthy product for the next generation of infants. And that brings us to the end of this episode, the first episode of the Scoop podcast. Thank you so much for joining me. Please, if you've enjoyed this, please rate and review us wherever you get your podcasts from. And please join me on my next episode, where we're going to start at the very beginning, infant formula formulation and concept design. Until then, I'm Keren Breiterman, and we'll see you next time.